So one of the questions that most intrigued me was, how do you think about things? How does the brain do its work? And so during medical school, these kinds of issues were constantly most challenging for me. The first visit is mostly getting a sense of, what kind of difficulties or problems are they facing, and what are their expectations going forward, and how does this play a role in their life, and how can we best help them make some decisions. I usually use the metaphor of finding a place in the landscape of things. So you're standing here, you're dealing with this specific concerns, and you're trying to figure out what does this mean when I look forward. So it's getting an inventory of your strengths and your weaknesses and the best pathways that may be most meaningful for you. So I see it, and I usually articulate this for my patients. You see where they're coming from, what they're dealing with, and there's a small rule for you that maybe you can make things easier. Intellectually, it's very rewarding trying to figure out what's happening and how people are making sense of their lives. It's also emotionally rewarding when you see people take huge leaps of faith and strength, and then you see all the possibilities in people, and that's rewarding too. I have a lot of little things I do. I like running. I like going for hikes. I like cooking at home, reading and watching a movie. I also write and enjoy my vacations.